Hi, my name is Lauren, and today I'm going to be going over Practical Skill Lab 1, which involves properly dispensing a glucose meter testing kit to a patient, and the patient will be asking me a couple of questions, which will then lead to me doing a consultation with the pharmacist. So without further ado, let's begin. Hi, my name is Lauren, and I'm a pharmacy technician. How can I assist you today? You're looking to pick up a prescription? Okay, so I'm just going to need your name and date of birth. So Brian Davidson, and can you confirm your date of birth is February 22nd, 1976? And I just need you to verify your address and telephone number for me, please. So we're looking at 27 Bradford Street in Newton, Massachusetts, zip code 02456. Okay, and your telephone number is 617-848-2671. Okay? So it actually does say we have a prescription ready for you. Allow me to, just a moment to go and get it for you. So here's your prescription right here. It is a self-testing glucose meter kit. Everything you're going to need is right inside, and off to the side is a list of all the contents within the box. Do you have any questions for me? So you want to know how to use everything in the box? I'd be happy to go over that with you. So we're going to open the box. So what you have is you have your glucose system owner's manual. That'll explain everything about the machine, how to use it, how to properly take care of it, clean it, disinfect it. And then from there you also have some monitoring testing guides, which this is nice because then it labels what all the buttons do for you, and it also gives you detailed instructions with pictures on how to use it, but I'll be going over it with you anyway. And then here's some more information pamphlets. This is for the Lansing device, which is this button which is this thing right here. And this is what's really important. It is your self-test logbook. So you should view this as a journal where you're going to be keeping track of your results. So what it is that you're going to look here. This is the date. So then you would write the date of when you would record your blood sugar levels, and you could do it either before or after any of the 3 main meals of the day, breakfast, lunch, or dinner. And then you would also record if you were on any insulins or other medications. And then the very last column here, it details the notes. So you would take any notes about how you felt, because then that's important so that when you bring this logbook to your doctor, he would be able to, he can tell how you were feeling, if you were feeling any discomfort, and you were on a certain medicine when you took your blood sugar level, he would be able to properly assess you and give you the best treatment possible. And then this right here is a travel case, which is very handy. So if you're ever out of the house, this little case here will make sure that everything you need is all in one spot, so you never have to worry about losing anything. And this is the glucose meter device. This is the primary device you're going to be using to measure your blood sugar levels. And if you look right here, you turn it on by pressing this middle button with a giant white circle. You press and hold, and the screen should look like this. That's how you know that it was turned on correctly. And then what you would do after that is you would take your testing strips, which is in this box right here. And for your prescription, you were prescribed 10 of them. So we're just going to make sure that you were prescribed the right amount, which you were. So it comes in this little vial right here. I'm going to open it up for you to show you what they look like. Okay, so this is what, this is what a testing strip would look like for you. So what you're going to do is you would take this testing strip and insert it with this part here going into the device. You should hear a little click. And then when you hear the beep, you know that it was inserted successfully and correctly. And then from there, what you would do is you would take one of your lancets, which there are 10 of them for you. I'm going to take one out to show you what they look like. Okay, so your lancet looks like this. And then what you're going to want to do is you're going to want to turn this circle to reveal a tiny needle. And now for the sake of the demonstration, I'm going to put this back on. Okay. And then what you're going to want to do is, this is your actual lancing device. So then to put this, we want to put the lancet into the lancer. So now you're going to want to pull the cap from here up to reveal this little module. You're going to want to insert this in, and it should look like this. That's how you know that you put it in right. So now we are going to want to put the cap on, but remember that this little blue circle is going to be off. So it would, when you put it in correctly, it should just snap like that. And then what you would do is you would pull this down, and you should hear that click. So before you prick yourself, it is absolutely necessary that you sterilize the surface of your finger with one of these. It's an alcohol wipe. And you use this because you would never want to prick yourself on a surface where there's any kind of excess dirt or bacteria. So after the surface of the finger you're going to prick is properly sterilized, you're going to want to put your finger, whichever one you choose, on the surface of the pen like this. And depending on the thickness of your finger, you would adjust this little tab here. It's numbered 1 through 5. So if you have a thicker surface on your finger, it's recommended to go to the 5 setting. If you have a thinner surface, it's recommended to go between 1 or 2. But there's no right or wrong. It's all about whatever works best for you and what your personal preference is. So after that, the needle would be exposed through here. After you would push this trigger, it's this little gray button right here. So now when you hear that noise, it means that you actually were able to prick yourself. So now what you would do is you would take your finger that you pricked and put it on here, and you would want to make sure that it's done on a flat surface. But for the sake of the demonstration, I'm just going to lift it to show you. You put your finger so the blood goes into that little tiny silver line in the middle. And then if it's done correctly, your blood sugar level would be recorded right here. So after you get your blood glucose level, you're going to log all your results in the self-test logbook. And now that I have explained and demonstrated the contents in the box, do you have any additional questions for me? So you want to know which finger would be best to prick your finger with. So it is recommended that you do either your middle or your third finger, so middle or ring. And that's because it could be done, you could prick yourself with it being the most comfortable that it could be, and you wouldn't feel any discomfort afterwards when you use those fingers. Do you have any additional questions? So you want to know any alternatives for cleaning your finger if you don't have the alcohol wipes. So if you don't have these, it's recommended you can also wash your hands with any kind of warm soapy water, and just make sure you really get in there with the soap. And you have to make sure that your hand is completely dry before you would prick yourself. So do you have any more questions for me? You want to know how to clean the device? Okay, so if you refer to the owner's manual on page 39, let me see if I can find it. There we go. It goes over how to clean and disinfect the meter, and so you never lose your place. I'm going to bend it for you to mark it. So it's recommended that they only say to clean it with what's called a super sandy cloth wipe. And those, they sound complicated, but they're very easy to get. You can find them on Amazon, Walmart. They even say Office Depot has them, or any other office related store carries them as well. So do you have any other questions for me? Okay. So you're experiencing adverse effects with your medication. So for that, I'm going to redirect you to the pharmacist for a consultation because he'd be better equipped to assist you with that. So just allow me one moment to put all the contents back in the box and I'll go get the pharmacist for you. And here is your glucose meter kit, and just allow me 1 second to go get the pharmacist for you. Thank you for your patience, Mr. Davidson. Mr. Davidson, this is Pharmacist John. Pharmacist John, this is Mr. Davidson. He came to pick up his glucose meter kit. I already went over the contents of the box and how to properly use it. He wanted to know if he could possibly change his prescription because he's experiencing adverse side effects, and I recommended to him to have a consultation with you because I said that you would be better equipped to handle this situation. And Mr. Davidson, if that's everything that you need from me, it was a pleasure meeting you, and I hope you have a great day.